The Hospice Palliative Care Association, or HPCA, is a membership organisation for South African hospices. 155 member hospices currently care for over 60,000 patients and families throughout South Africa. Airborne Consulting was contracted to develop a hospice data management system. This generates valid, reliable and comparative data for the purpose of hospice development, donor information, research and public use. While some member hospices receive a small government subsidy, they rely primarily on corporate and individual donors to allow them to continue providing services. With 155 member hospices responsible for recording details on the care they provide, the organisation was faced with a number of challenges. Because these massive volumes of data were mostly paper-based, monthly reporting was manually intensive, frequently delayed and prone to error. It was vital that HPCA established a more effective and consistent process of gathering data from their member hospices.
There was a need to design a system that could be flexible in terms of its information architecture, need to be scalable because the demand for hospice services is likely to grow and grow quite rapidly. And what we wanted was a partnership with a consulting firm that would make extensive use of the intellectual capital of what a hospice is all about, that's invested in caregivers, administrators and planners at the HPCA head office. I think Airborne for us became the partner of choice earlier on, and the evidence to date is such that when I look at the quality of the deliverable for the HPCA, I think we made the right choice.
The hospice database management system runs standalone at each of the hospices associated with the Hospice Palliative Care Association. It enables the hospice staff to capture pertinent details about their patients, the caregivers, as well as the interventions that is provided to their patients, their family members and friends. The HPCA staff can at any point in time draw statistical information regarding the demographics of patient care within each of the provinces, health districts or at a hospice.
The system that we use at St. Luke's Hospice is very effective because we have these forms which the staff completes. It's all the information on the patients and the family members and also the interventions that they do. The information gets put into the system, and the system has actually allowed us to be able to see how much care and how effective we are in giving care to the patients and the family members.
The system has facilitated ease of use with an intuitive, visual and responsive user interface. It has also ensured consistent and efficient recording of patient details and the care provided, as well as 24/7 access to information pertaining to the HPCA member hospices. The capability it provides to analyse staff and caregiver time allocation in respect of their care is also vitally important in the management and enhancement of this care to patients.
The hospice data management system has taken HPCA and our member hospices to a new level of professionalism in reporting on the care that we do. It's enhanced our credibility with our funders, with the Department of Health and with the communities we serve. With this, we're getting extra funding that allows us to extend the reach of our care to more patients throughout this country and has contributed to sustainability of hospice care in South Africa.
The accurate collation of data will lead to many opportunities in terms of understanding quality and cost of care at various institutions. Management reporting will also in future demonstrate immense value in helping us to understand the demographics and broader social issues within the South African environment.
Airborne is committed to the social upliftment of all South Africans, and as such we were inspired by the work done by HPCA and its affiliate members.
Airborne is committed to continuing down this road with HPCA and fundamentally be a part of making a difference.